You feeling a bit better? All right. Do you mind if I have a listen to your chest?
Monday morning in the A&E department at Blackburn Royal.
It's got worse and worse, and I can't sleep on it. It's in pain all of the time.
They'll see around 350 people here today.
Is there such a thing as a typical day in A&E?
There's no really typical day in A&E. It's one of the most intriguing things about the specialty and most exciting things.
I had a severe pain in my side. I went to the doctor and he suggested I get to the hospital as quickly as possible.
I've injured my foot, so I thought it was just a sprain, but I think it's a little bit more than that. So I've come in to see A&E today.
Yeah, it's cubicle 15.
On Friday I collapsed in Asda, so I went to my GP this morning and she referred me directly to her because she thinks I might have a blood clot on my lung.
Well, it's a little known fact, but the Blackburn Royal Hospital actually sees more ambulances arriving each day than any other single hospital site in the northwest. On average, they say an ambulance arrives here every 9 minutes of the day.
This is a busy place and it's getting busier. May, June and July saw some of their busiest weeks in the history of the hospital.
Not only is there pressure at other local A&E departments, but there's also significant pressure in primary care, with the primary care facilities and general practices struggling to cope with the demand that's being placed upon them.
So at one end we've got increasing demand with restrictions and problems in terms of the number of staff that we've got. So somehow we're trying to manage that equation.
So you're short of staff. Is that because you're short of money, or because there just aren't the staff out there to employ?
I actually do have the funding to employ more doctors and nurses, but there is a national shortage. So that's a real issue for us, and it's particularly pertinent in areas such as accident and emergency.
And of course they must always expect the unexpected.
These screens are for infection control reasons. We've had a patient that's presented this morning who's returned from Saudi Arabia with respiratory symptoms and a temperature. And our concern is that they may have the Middle East respiratory syndrome.
MERS?
The MERS.
That's quite serious, isn't it?
It is potentially serious. It's important that we do take precautions.
The patient was admitted, but tests revealed she didn't have MERS. So what of our other 3 A&E patients? Well, Manisha limped off after treatment for a sprained ankle.
I've got to rest it, elevate it, maybe within 2 weeks have to go back to see the physio for it as well.
At least it's not broken.
Yeah, thank God for that.
Yeah. So the most of the pain is here?
Well, when you press there, it's here.
Nigel turned out to have viral gastroenteritis and is improving well.
Have you had any similar problems in the past?
And Stephen Bolton was admitted for further tests. For the staff here, just another typical day at the office. Dave Guest, BBC North West Tonight, Blackburn.